Hey, I'm Dr. Reynolds.
I'm Dr. Coltrane.
We wanted to talk a little bit about health. I think if you've come to our Gladiator courses, our alumni day, stuff like that, we've had more in-depth things that we talk about, so we want to talk about a more general health at home. Some of the stuff that you need to do at home that you're probably not doing, probably isn't on your radar, stuff that you need to be aware of. At the age of 50, everybody needs to be getting a colonoscopy. You need to talk to your doctor because for some people this ends up happening a little bit earlier. If you have any history of colon cancer in your family, if you have any high-risk situations. So just touch base with your doctor and ask when you need to get that done. Prostate screening for men is not done as frequently as it used to be, but that's something you need to talk to your doctor about. And it can be, again, individually variable, depending on whether or not you're having symptoms, stuff like that. For females, you need to start having pap smears at the age of 21. You need to be having them at least every 3 years. Unless you're high risk, you need to have them more, but you need to have a conversation with your OB-GYN about how often you need to be doing that, how often you need to be getting tested. And it can change a little bit after 30 depending on some other tests that they do. Also need to be talking to your OB-GYN about when you're going to get mammograms, because that's another big important thing for women that can be preventative. A lot of breast cancer runs in our family, so that's something we talk about a lot here. Some other screening that needs to be done once you get older is more dependent on risk factors. Have you ever had a cigarette? How many cigarettes have you had? What kind of smoking and stuff? But that's something you need to touch base with your primary care doctor about. I know we're saying that a lot because each of the situations is individual, but what's important is that you stay on top of your preventative care. There's a lot of different cancers out there that can actually be prevented or intervened on early and have a huge different outcome if we're taking care of things on schedule the way we're supposed to be doing. The general population doesn't know it as much as the medical community, and the medical community is so used to it that a lot of time they take that for granted. So that's stuff that you need to be staying on top of, especially if you have any kind of symptoms that make you worried. And even if you didn't, even if you're 21, go find a primary care doctor and find out the stuff you need to be doing, the vaccines you can be getting. We actually have vaccines now that can prevent different kinds of cancers. The HPV one used to be thought to only prevent cervical cancers. Some stuff now that maybe that's causing throat cancer in men. So if you can get a shot and end up not getting cancer because of it, or if you can get a screening and end up having a polyp removed that might have turned into cancer, it's a huge life-changing deal. Anything you want to add to that?
No, I mean, that sounds great. I mean, Dr. Reynolds is a wealth of insight and resources. I think he touched all the
almost
high points,
astounding.
and now he's ruining it. Hopefully he can edit things. High points, he talked about the HPV vaccine. I think it's very important getting a primary care doctor, having that primary care provider, at least seeing them once a year, even when you're in your 20s is a high point. I mean, hypertension is one of the things that can be hereditary, it can be genetic, and you have to watch out for that. It's not something that you're going to necessarily feel symptoms of, but you're going to get to, these times where you're 40, 50, and all of a sudden you're hypertensive, you're going to be at a stroke risk, you're going to be at a heart attack risk, whereas if you're in your 20s and you check on it, then you could have a preventative maintenance versus talking about having to take pills for the rest of your life.
Yeah, for some reason we talk about doing regular oil changes on our cars, but we think our bodies are immune to it. But a lot of this stuff, like he was saying, is by the time you're having problems, the problem's already there. And it's stuff that if you just started looking at when you were 25, could have had a huge different life course.
It's too late. And if we're going into preventative care medicine and things like that, it's beyond the scope of the doctor. It's beyond the scope of going into somewhere. It's taking care of your health, be that with, exercise, mental health, spiritual health, making sure you connect with your foods and things like that, and just making sure your overall well-being is taken care of. That's a huge aspect of life that people kind of neglect, I think.
Exactly, yeah. That's one of the pillars that we have with Gladiators and Dockery. A lot of doctors, if they're good doctors, will tell you, I'm on the ship with you. I have all the maps. I can tell you where we're headed. I can tell you what to change to head to different places, but you're the captain of the ship. You have to be able to steer it. You have to be able to look at the maps. You have to make some decisions. I think we talk about, go on a run, lift some weights, especially in the Gladiator, Valkyrie groups. Fitness in terms of exercise is a big part of it, but neglecting the other parts of your health that can actually ruin that aspect of it is big.
Absolutely.
All right. Well, if you guys have any questions, especially if you're in the Gladiator Valkyrie groups, you know how to get a hold of us. We're always happy to help. If you're not, you should be, and continue living every minute.